Hello everyone, welcome to my talk about the MAMA-CT, Phenological Diagnostics in a New Dimension. In this talk I want to focus on the clinical experiences with this system and some really nice cases I can show you from the last weeks doing this modality. So what can we achieve? We can do MAMA-CT with contrast media. And in this case, in comparison with a normal plain mammography, in this case, there you see a marker in the position of the tumor, but in correlation, you see the MAMA-CT reconstructed slice in an MLO or OBL manner. And using contrast media, you clearly see the delineation of the tumor, the malignant tumor in this case. On the other image, it's a CC image with a correlating mammography and the MAMA-CT slice. By the way, these images are from Professor Dr. Med Wenkel from Erlangen. Thanks to him to these great images and cases. The next case is a Hamaratoma of the right breast. You see the clear delineation of the tumor, no contrast in it, and the corresponding ultrasound shows you the typical findings in case of a Hamaratoma. So much to get wrong with this technique. In this case, the ultrasound of the tumor looks quite okay. Maybe you think about a cystic lesion or something else, but doing a mammo-CT delineates the tumor as a malignant one, taking a lot of contrast media, and is clearly depictable in the dense breast tissue of the patient. You can reconstruct the images freely in actual coronal or sagittal direction. Same case, same tumor, corresponding mammography. It's hardly to see the tumor in the mammography after this image is taken after putting in a hook wire to give the surgeon a guideline to operate. In this case, for example, you see the strength of the method because it's the first time you see the tumor, which is depictable on the plain mammography, and the corresponding CT images without contrast show you the tumor. They show you the microcogs in 3D, but especially when you use contrast media, the CT imaging turns into a functional imaging, because in this case, you clearly see the true size of the tumor in correlation with microcogs. You even see in the center of the tumor some necrosis. And these images are really new, are really breathtaking, I think. Also, in small, tiny microcogs, due to the very high resolution of the CT, we are talking about 0.15 millimeters resolution in all 3 dimensions. You get a meaning about the microcogs in a 3D manner the first time ever. Also in this case, small tumor with microcogs in the breast without contrast, but it's a big step into 3D imaging at least. Looking at a multifocal tumor in the breast, running through the different projections, axial, coronal, and sagittal, you are able to recognize the distribution of the multifocal tumors in this breast. This imaging is done after contrast administration. And when you correlate those images with MRI, which are done in addition, you see the strength in native, but also in the post-contrast images. But you have to keep in mind that the MRI has a factor 10 less resolution than the CT. And the MRI, we are talking about more or less 1 millimeter resolution. In the CT, we are talking about 0.15 millimeters resolution, a factor of 10 higher resolution in the CT. You can reconstruct those images in a 3D manner as you like it. For this example, you clearly see the multiple foci of the tumor after contrast administration, and I think these images are astonishing and kind of revolution in senological imaging for sure. This is a case we have done 1 month ago to give you a kind of feeling how this 3D imaging is working. I'm going to rotate the breast and then change window and contrast of the imaging. This is done routinely and very easily. And going deeper and deeper in the breast, you now realize there is some vascularization, there is tissue, there are microcalcs, but also you see after a short while there's a tumor in the breast. And also this rotating and 3D manner of the imaging gives you a complete 3D imaging effect the first time we are doing xenological imaging. This is not comparable to anything I have seen before. And stopping those rotation, you see tumor, you can pick up the size of the tumor, you can correlate it with all the other structures in the breast, even with some microcalcs, which are benign, by the way, and some vascularization. Next case shows you a woman with some suspicious microcalcs. The normal mammography, I can give you some more detail. You see there are suspicious microcalcs in the CC and OBL view. And when you go to the spot imaging, you see, okay, that doesn't look quite good. We go back to the normal imaging, and we have done a mammo-CT on this patient. And showing this is absolutely astonishing, I think, because now you have the first time to correlate in a 3D manner the position of the microcalcs and also the contrast reaction of a malignant tumor in one image in a 3D manner. You see the rotation. You can also have a look at the single slices and reconstructions you are used to, but to show you the possibilities, I think it's much better than to look to this breathtaking images. You can zoom, and now you can clearly see microcalcs in a 3D manner and correlate it with the rest of the breast and to show it to the patient. And you can also show it to the surgeon and say, okay, this is the location you have to care about. This is also a nice case I have done, let me say, 4 weeks ago. This is a case where, as an examiner, you might notice this tumor in the no man's land. So there's a heavy distortion. You see it also on the OBL view. If you are familiar with mammographic imaging, you may also notice in this resolution that there's something going on in this area of the breast. But you can't be too sure where it's here. Maybe, to give you some help, it's in this location at 3 o'clock in the imaging. Later on, we did tomosynthesis on this case. First step of examination. Tomosynthesis shows you for sure a clear tumor at 12 o'clock. Go on. And maybe some distortion here. So if you look at one special slab which was produced during the tomosynthesis, you have a lesion here and maybe two lesions here, but you don't really have a 3D imagination of what's going on. Assessment means do an ultrasound, do a biopsy. This is the same case. So firstly, you see the tumor at 12 o'clock with a clear malignant pattern, hypervascularization and the power duplex, and also you see a high stiffness in the elastography at the tumor at 3 o'clock. I can go on with this. Yeah, red area, stiff tissue means tumor. And also you see clearly the biopsy needle in front of the tumor. And yeah, we did an MRI as well. This MRI works well. We know this and we use it for a long time. This is a reconstruction in axial view and also in the coronal view. You clearly can see the tumor in the location you have expected it. But that's the usual way to look at these images. What I can show you now is a 3D imaging of the breast with the multiple tumor manifestations in this breast. And you see clearly the size. You can see clearly the relation between those tumors. And at least you see a fourth location, which is right behind the nipple in front of the chest wall. Maybe we would have lost this information without the mammo-CT. And these images are absolutely astonishing. And I think it's really the next step in xenological imaging. The same issue is for the pain-free examination of implants. Because you do the examinations without any compression of the breast, you can do it in a high resolution and end up with a high resolution 3D imaging of the implant and all the surrounding. That means muscles, tissue, implants, everything you want to see in the same time, and microcalcifications. So this is really a unique display of calcifications, also in case of a capsular fibrosis, which can't be seen on a mamma MRI. You can't see any calcification in a mamma MRI. So this is the next step, I think. So having shown you my images, I think this is really a new dimension. It is 3D imaging of the breast without any superimposition. It is a functional examination by using contrast media. It has the possibility to go in a high resolution 3D imaging with isotropic voxels up to 0.15 millimeters resolution per voxel. We have an excellent contrast between the glandular tissue and the calcifications. We have at least a short examination time, about 12 seconds per breast, at least 5 to 7 minutes for the whole examination. We have a very low dosage, and we have outstanding patient comfort because there's no compression or anything else which is altering your patients. I see the indication for mammo-CT in case of very painful mammography and in fear of pain for the patient. or personal reasons or any other reason to reject doing a mammography. We use it especially in the assessment for further clarification of conspicuous findings like microplaques, or in case of multitricity of a tumor, and to have a decent look at the exact tumor size. You can use it for planning of a surgery and for sure for monitoring after neoadjuvant chemotherapy. At least it is suitable for patients who have contraindications for going into the MRI, like a pacemaker or claustrophobia, or maybe they have implants or an allergic reaction against contrast media, which is used in MRI. The costs have to take private, maybe through the private insurance, or at least for self-payers, and are about 350 euros per examination. There's no way in this status to get a billing through the statutory health insurance, and the scheduling is routinely done via our head office or directly in my praxis. So thank you for your attention, and if you have any questions, don't hesitate to ask me by email or by phone. Thank you very much for listening to this talk.